Hello, my name is Jessica Tsvetanova. I'm a nursing student at West Coast University, Los Angeles. I'm currently in intermediate med-surg and nutrition. The global healthcare topic I've chosen to talk about today is child healthcare. According to the World Health Organization, 5.9 million children under the age of 5 died in 2015. That's 16,000 every day. Now this is shocking considering only 6% of that number comes from the US. So, what causes these deaths? And why is there such a disparity? Well, looking at the data, the leading causes for deaths under the age of 5 for children are preterm birth complications, malnutrition, pneumonia, birth asphyxia, diarrhea, and malaria. What's even more disturbing is that more than half of these deaths are due to conditions that could have been prevented in the first place, or conditions that also could have been treated if medically detected early. But healthcare isn't the same in every country, and that's the main reason for such drastic differences. For example, you're a pregnant woman living in the US. You schedule your prenatal visits, which are very important because they allow you to ask questions and to see the development of your baby. All is well. What a relief. Finally, after 9 months, you're ready to deliver. You go and walk down the street, since it's readily available, your local hospital, with adequate staff and well-educated doctors. You aren't worried because the delivery was a success. You stay there for 3 days to bond with your bundle of joy. The nurses there are very supportive and attentive. They teach you how to breastfeed and how to recognize the signs of hunger. They also teach you about nutrition and encourage you to make healthy choices. Now, let's take the same idea of you being pregnant and changing only one thing, the location. Picture this. You're in Uganda where there is no health insurance plans. Instead, you are charged for each treatment and visit. The nearest hospital is a day's walk, so you opt to only go there when something is wrong. You have questions, so you converse with the mothers of the village. They offer their home remedies and their experience. As you listen, you become to feel afraid. You're wondering, is my child going to suffocate? Will it be too soon? Will it be painful? Will I bleed? Will I survive? Food is scarce, so you lay in bed hungry and anxious whether tomorrow will be the day you deliver. Pain! Your water just broke. The women are rushing to your aid and they're preparing for delivery. The elderlies are laying blankets that they have washed in a river, the same one you used to clean yourself after defecating. During the delivery, there's a problem. You don't see the head of the child, you see the butt. The women are trying to pull it out while you cry there in pain. Someone offers you a herb, but you refuse to take it because you're too concentrated on your child. It's abnormally still. Unbelievable, isn't it? Living in the US for so long, I didn't realize the things I took for granted, such as clean water, fresh produce, and quick access to healthcare, which are luxuries in other countries. Unfortunately, it isn't only Africa. I got my first shock of reality volunteering as a member of Board of Trustees at my church. Some of the duties consisted of feeding the local community, being Santa Claus and giving presents to children, and organizing fundraising events for charity. One charity in particular had opened my eyes to the cruelty of Bulgarian child healthcare. When this 12-year-old European girl diagnosed with a rare cancer sends us a picture asking for help and seeking to come to America to get cured. And it doesn't just stop there. Over the years, I've seen an increased amount of organizations from various parts of the world requesting financial support to help children with their basic necessities in daily living, including my visit to Thailand to help a local clinic. My heart goes out to them when I hear their stories, and I begin to think, how can we as future nurses help contribute, besides just financially? How can we change next year's data and eliminate the evident health disparity? The answer is through education. If selected, I wish to continue to enrich my knowledge about child health and encourage my fellow peers to collaborate. Together, I know we can develop innovative solutions to combat today's global health problems. I thank you for your time and consideration.